I don't want to be negative, Mr. Trump said. I want to give people in this country hope. That's right. We're going through probably the worst thing the country's ever seen, he added. We lose more here potential than you lose in world wars as a country. Wow. As many as 25% of people infected with the new coronavirus may not show symptoms. You know, that's the big threat about it. A startling high number of people infected with the new coronavirus may not show symptoms, the director of Center for Disease Control and Prevention said, complicating efforts to predict the pandemic course and strategies to mitigate its spread. Wow. In particular, the high level of symptom-free cases and leading the CDC to consider broadening its guidelines on who should wear masks. They should not just wear the mask. I think they should wear the full face mask to guard their eyes. The nose and the mouth is mucous membranes, but a few people don't realize, or some people don't realize, that the underside of the eyelid is mucous membrane as well. So if droplets get into your eye and the person coughs or sneezes and is infected, you're now infected. So you should protect your eyes, ladies and gentlemen, my friends. Protect your eyes. Let's see. This help explains how rapidly this virus continues to spread across the country. The director, Dr. Robert Redfield, told National Public Radio in an interview broadcast on Tuesday. The agency has repeatedly said that the ordinary citizens do not need to wear masks unless they are feeling sick. Really? But with the new data on the people who may be infected without even feeling sick, or who are transmitting the virus for a couple of days before feeling ill, Mr. Redfield said that with such guidance has been critically reviewed. I bet. Masks. The advice from public health officials have been confusing, leaving us to decide whether a DIY mask is better than nothing. I would suggest a full face mask, like I said, and I've been suggesting this since January, folks. My articles, if you look back in my articles and my websites, you would have seen that I've been talking about full face masks for quite a few months. Should I start wearing a mask? Researchers do not know precisely how many people are infected without feeling ill, or if some of them are simply pre-symptomatic. That means that they've got the disease, don't feel it, but yet they're contagious. But since the new coronavirus surfaced in December, researchers have spotted unsettling anecdotes of apparently healthy people who are unwittingly spreaders. Patient Z, for example, a 26-year-old man in Guangdong, China, I hope I pronounced it correctly, was a close contact of a Wuhan traveler infected with the coronavirus in February. But he felt no signs of anything amiss, not on day 7 after the contact, nor on day 10 or 11. Already by day 7, though the virus had bloomed in his nose and throat, just as copulating as in those who did become ill. Patient Z might have felt fine, but he was infected just the same. Researchers now say that the people like Patient Z are not merely anecdoted, A-N-E-C-T-O-T-E-S. I hope I pronounced it right, ladies and gentlemen. If I don't, please forgive me. For example, as many as 18% of people infected with the virus on the Diamond Princess cruise ship never developed symptoms. Wow. According to one analysis, a team in Hong Kong suggests that from 20 to 40% of transmissions in China occurred before the symptoms appeared. Wow. Huh. The high level of converse spread may help explain why the novel coronavirus is the first virus that is not an influenza virus to set off a pandemic. When to wear masks. Widespread use of non-medical masks could reduce community transmission, but recommending their broad use could also cause a run on the masks that healthcare workers desperately need. You have to make that decision, folks. Ignoring party lines, governors challenge Trump's assertions on availability of supplies. A chorus of governors from across the political spectrum is publicly challenging the president, the Trump administration, assertion that the United States is well stocked and well prepared to test people for the coronavirus and care for the sickest patient. Huh. In New York State, the center of the national outbreak, with at least 1,550 deaths, Governor Andrew M. Cuomo said on Tuesday that the country's patchwork approach to the pandemic had made it hard to get desperately needed ventilators. It's like being on eBay with 50 other states bidding on a ventilator, Mr. Cuomo, a Democrat, said in his daily news brief. Governor Larry Hogan of Maryland said on Tuesday that his state was flying blind in the fight against the coronavirus because officials did not have enough tests. When asked during an NPR interview about President Trump's comment suggesting that a chronic lack of test kits was no longer a problem in the United States, Mr. Hogan, a Republican, did not mix words. Yet that's just not true. Across the country, America's governors are going head to head with the Trump's administration over the need for testing supplies and ventilators. At times, defying party lines, some have sparred with the president on phone calls and in public interviews. Still, others have sided with the president or calculating that it would be easier to get the needs of the states met with support and praise. Wow. The coronavirus doesn't distinguish between red states and blue states, Mr. Hogan, the Republican from Maryland, and Governor Gretchen Whitmer of Michigan, to a Democrat, said a bipartisan op-ed, and neither can we. Wow. They have to get together, folks. They have to. See which states and cities have told residents to stay at home. In an attempt to stop the spread of coronavirus, a vast majority of states and the Navajo Nation have given directives affecting more than 9 in 10 U.S. residents. 9 out of 10 U.S. residents. Wow. News and news and news, folks. Coronavirus. Let me end with this, folks. When Maria Jose Rodriguez heard on local television that a town in northeastern Spain would be locked down within hours, she knew she had to leave or risk losing her family's business. So what did she do? She grabbed a bag of groceries, a fresh change of clothing, and her car keys, said goodbye to her husband, and drove to her son's apartment in a nearby village above the family bakery. For more than 2 weeks, she had been locked out of the town, Igualada. Her husband had been locked in, and they have no way of knowing how long it would go on. Had I not moved out to keep running the bakery, would have to close it. Mrs. Rodriguez, 63, stayed at her shop in the village of La Proba de Calarmu. But we'll be fine. I called my husband 50 times a day, at the very least. Amen. So at least she took care of business. She knows what to do. She made a quick decision, and it paid off, folks. Folks, this is all I have to talk about today. Again, look down, click on the subscribe button, and recommend my site, my articles, to all your friends, Father. Spread it out. I mean, Father. My readers, my friends. And spread it out, folks. I need your help. I really do appreciate it. And if you want more information, you can go to one of my websites. It is all lowercase, H as in Harry, T as in Tom, P as in Paul, S as in Sam, / journey through wealthyaffiliateland.com. And my other one is https : survival prepper self-reliant.com. All lowercase, folks. And again, if you need to get a hold of me, email me, is frenchcajun@gmail.com. That's all lowercases, ISFRENCH, C as in cat, AJUN as in Nancy, @gmail.com. Again, subscribe, folks. Click on that subscribe button. Give me all the help you can. I certainly appreciate it. Again, folks, have a good evening, a great night, and a better tomorrow. Stay safe and healthy, and may God bless.